Did you know that 1 in 4 Americans are going to suffer a stroke in their lifetime? And guess what? It is totally preventable. A stroke happens when something causes a blockage in one of the main arteries going to one part of your brain. Sometimes it can be a blockage or a major bleed inside the brain. And that's why we see that part of the brain stop losing function. So you might lose your ability to form memories, you might lose your ability to move one part of the body, you might not be able to speak, and of course, much worse things can happen. What most people don't realize that in your 30s and 40s, you can start building the kind of resilience inside your brain and the blood flow to the brain that's going to help you prevent strokes. The American Heart Association, the American Stroke Association in 2024 published a guideline. This is backed by multiple physicians, multiple research institutions that have shown that strokes are fully preventable. So in this video, we're going to go through that list. I'm Dr. Rashori, family medicine physician turned health coach, and here's your important stroke prevention list. Stay tuned to the end of the video where I answer the top 3 questions my patients have asked me about stroke prevention over the years. Number 1 on the list is going to be blood pressure. Pretty much anything over 120 over 80 is going to increase your risk. Now, if you're already super healthy and your other risk factors are very low, you can have a blood pressure in the 140 over 90 range and your risk may minimally go up. But whatever you can do to lower your blood pressure is going to have a major impact on preventing strokes. So here are the 3 things that you can do to help lower your blood pressure. Number 1 is going to be stress management. Now, we can't avoid stress, but the things that we can do to cope with stress is going to have a big impact. Number 2 is going to be exercise. Any kind of movement. It could even just be doing chores or, of course, going for a beautiful walk outside. And the third one is going to be weight management. If you're carrying extra weight, specifically visceral fat, lowering that extra weight is going to have a positive impact on lowering your blood pressure. Now, I know that most of you don't smoke, but any kind of secondhand smoke, any kind of exposure to tobacco smoke is going to have an impact. Now, some of you might be heavy smokers. If you can cut back even by 1 cigarette a day, you're going to drastically lower that risk. The third one is going to be movement. It's going to be any kind of exercise that you can do. So there's a great study with bus drivers who are mostly sedentary and bus conductors who are going up and down the steps. They found that for the most part, the people who were going up and down the steps, moving a lot throughout their workday, had a much lower overall cardiovascular risk, including much lower stroke numbers. So anything you can do throughout the day, going for a walk, doing some chores, doing some exercises, is going to decrease that risk. That's why it's number 3 on the list. Number 4 on the list is going to be a Mediterranean style diet. We're not talking about a Mediterranean diet. It could be Mexican food, Indian food, Persian food, Asian food. Any of those can be turned into a Mediterranean style diet by focusing on lots of fiber, lots of healthy lean proteins, good healthy fats, so avoiding excess saturated fat, focusing on vegetable fats or natural fats, and also making sure that your salt and potassium are balanced. So avoiding excess salt intake and getting more potassium from fruits and vegetables. That's what a Mediterranean diet is, and it protects your brain, decreasing the risk of strokes. Number 5 on the list is getting more fiber. Now, we just talked about a Mediterranean diet, but whatever diet you follow, increasing your fiber intake has been shown to decrease your stroke risk, probably because it changes the chemicals that your gut bacteria secrete, lowers your blood pressure, improves your blood sugar. So focus on getting more fiber from fruits, apples, bananas, oranges, berries, or vegetables such as celery, spinach, Brussels sprouts, whatever you like, broccoli. Getting more of this is always going to have a much better impact on your overall health. It doesn't mean you can't eat meat. You can still have as much meat as you like, as long as this fiber aspect is protected. So that's 5 down and we got 5 to go. I know it's a big list. I would love to hear which one of these you're really struggling with the most. Is it movement, diet, is it salt? Comment below. I read every comment and I'm going to reply. So let's get to the next 5. And remember, stay tuned for the 3 common questions I get, which are going to be pretty interesting. Number 6 on the list is going to be your sleep. So this has a lot to do with the quality of your sleep, getting restful sleep, which is why sleep is one of the pillars of my trend pillar for healthy aging. But it's also going to be making sure that you don't have something hidden called sleep apnea. This is when you snore very heavy and you stop breathing. Now, your doctor, your clinician can help screen you for that. It's easy. If you get good sleep, you're drastically going to decrease your risk of developing a stroke. And I got lots of videos on sleep. Check out my shorts, and you can get the link below in the descriptions as well. The goal with sleep is getting 7 to 8 hours of protected sleep. You might be in bed for 10 hours, but you need to actually be asleep. So multiple times when you wake up in the middle of the night, those don't count. So you got to subtract that. Most of us are probably going to need 8 to 9 hours in bed to get 7 to 8 hours of good restful sleep with deep and REM sleep and some other light sleep in between. Number 7 is going to be knowing your baseline risk. Are you at higher risk for stroke? If you can identify that in your 30s and 40s, then you have a much better chance of taking the right steps to lower that risk. It could be family history, it could be your blood pressure, it could be excess visceral fat, it could be some inflammation going on in your body. Work with a physician or a health coach like myself, identify what you're at risk for, and start bit by bit addressing every one of these risks so you can lower your risk of developing a stroke. Number 8, that's going to be your cholesterol, your lipids. So generally, American diet, Western diets are going to be very high in saturated fat. So we're talking about butter, we're talking about milk, even yogurt has saturated fat, and a lot of animal products like meat are going to have a lot of saturated fat. And we don't get enough fiber, which actually helps lower your cholesterol. The data shows that the higher your lipoprotein, so ApoB, LPA, like your LDL, your HDL, essentially these are all the same words. If these are excessive or not properly balanced, then you have a higher risk of depositing plaque inside the arteries of the brain. And if those plaque eventually break off, that's when a stroke can develop. So focus on more fruits, more vegetables, like we mentioned, more fiber, and decrease your intake of saturated fat to help lower your cholesterol and improve your overall risk. Number 9 is specific for women. So if you've had problems with endometriosis, difficult childbirth, or any other reason where you may have been exposed to excess estrogen in the body, it's worthwhile for your doctor to know, because this is also part of your particular risk baseline. And there are changes that your doctor can suggest, lifestyle changes that can help decrease your overall estrogen exposure. For some people, there are medications that can help, and this will drastically decrease your risk of developing a stroke. Number 10 is an interesting one because taking supplements can actually backfire. Now, there are many different types of supplements that people take, from vitamin C to plant extracts, to black cohosh, to magnesium, and they take these things for the purposes of decreasing the risk of developing a stroke. We're not quite sure why some of these supplements actually will increase your risk of stroke. And the reason might be because you're now thinking that the supplement is going to protect me, when in reality, there was something else that you probably should have prioritized and optimized. And so for whatever reason, whatever the underlying reason might be, the AHA and the American Stroke Association recommend against supplements for the specific reason of trying to decrease your stroke risk. So there you have it. These are the 10 recommended guidelines by the American Heart Association, American Stroke Association of 2024. And now we know that these small daily habits, these small choices, are going to be so much more potent than even medication. This is highlighted in the guidelines. So if you need help figuring that out, you can book a coaching call with me. The link is in the description. And now on to the 3 questions that I promised you. Number 1, are salt substitutes okay? So this is for somebody probably who loves salty foods. KCl, or potassium chloride, you can buy it at any grocery store, it comes in a little salt shaker, is a fantastic way for you to replace some of your salt. If you don't like the taste of it, some people don't notice, you can mix it with half regular salt and then half potassium salt, and it's going to give you actually more potassium, so it's good for you. It's going to lower your blood pressure, decrease your risk of stroke, and is a very safe alternative. Number 2, what about fish oil? Well, the studies on fish oil are quite weak. For most people, taking fish oil or just even eating more fish for the sake of fish oil is not going to lower your stroke risk. So the recommendation is to eat healthy overall, following that Mediterranean style diet. But taking supplemental fish oil is not going to lower your stroke risk. Number 3, what about taking a baby aspirin or aspirin in general to decrease stroke risk? Now, the problem is some strokes are because of excess bleeding. So in fact, the studies have shown that if you take aspirin for stroke prevention in general, your risk of stroke is actually higher, the risk of bleeding is higher. So aspirin is a no-no for stroke prevention. And if you want to know if you're on track to age healthy and prosper, live well, prevent chronic disease, I got a fantastic quiz linked below. You can take that quiz and find out what your healthy aging score is. And remember that healthy aging starts with the choices you make today.